Welcome back to ARC Maine. Tomorrow is World Mental Health Day, a day to raise awareness about mental health issues and mobilize efforts to support mental health.
Statistics from NAMI Maine show more than 200,000 adults in Maine have a mental health condition. That's why support is so important. Here to tell us more is Dr. Lisa Lucas, a physician and owner of Fulcrum Family Health in Freeport. Thanks for coming out this morning and being with us. It's such an important topic. First off, you're a direct primary care practitioner. What does that mean exactly, and how is that unique?
Sure, thanks for having me. Direct primary care is just a different model of offering primary care to our patients. We've noticed that insurance sometimes can be a barrier due to copays and deductibles. What we do instead is it's a different payment model. And so it's a monthly membership, kind of like a Netflix or a gym membership, where patients no longer have barriers to come in. There's no copays. They can come in as many times as they'd like. We often offer care through telehealth and phone calls, and we're much more accessible. So we're building more of a foundation of a relationship with our patients, so they feel more comfortable to talk to us and bring their issues to us when they have them.
What have you seen personally when it comes to mental health and the link between mental and physical wellness?
Yeah, it's really hard to overstate the relationship between mental health and physical health. It's pretty normal to have some changes in mood over your lifetime, and some of that can be kind of a normal process, like or maybe thyroid disease or menopause. But when it starts to really affect your function and you're no longer able to work or be present for your family and friends, you can start to see a steep drop off in interactions with your community and with your family, and that really can also start to present as physical ailments. So sometimes it's a little hard to tell the difference, and so it's important in our practice, we get to spend a lot more time with our patients with extended visits, and we really get to know our patients. And so when we start to see those changes, we're able to try to discern between, is this a physical issue, is this a mental health issue, or is it a combination of both?
And speaking of that, how important is getting people access to this and taking away barriers like affordability?
Sure. I think that's a big problem in all of healthcare, but especially because we tend to silo out mental health care from physical health care, which we're hoping to see a change in the future, because they really shouldn't be separate because they're so integrated. But patients will often not access care. They're worried about costs. There's not a lot of price transparency, which is something else that we're really trying to push for. So accessibility, where they're unable to call their doctor and actually get them on the phone or get an appropriate appointment at a decent time, or also they just don't know how much it's going to cost. So it's important for us to try to lower those barriers of accessibility and cost.
And so you're a TARO provider, which offers health insurance plans through the Affordable Care Act, the marketplace specifically. And just so you at home know, we're actually going to be speaking with the co-founder coming up later on ARC Maine. But can you tell us about the impact that you've seen this on patients as a result of TARO Health?
Sure. I think often we're able to, as primary care physicians and specifically a family medicine physician, we are trained actually during residency. We have integrated behavioral health training. So we're actually trained to recognize these diagnoses, but we often cannot find them care afterwards. So we're able to recognize, maybe start therapy, but we also need to work with clinicians in the area to provide talk therapy and other modalities. And that's often where people stop their care. Most patients that we refer to therapy don't ever actually make that appointment, either because they can't get in or because the cost is too high. So with TARO Health, they're now offering unlimited primary care visits with a direct primary care physician, as well as unlimited behavioral health visits, which is wonderful because if it's limited, then sometimes they'll even get care for a little bit of time and then that drops off. So ideal is that there's just no barriers, and that's what TARO Health is providing, which is unique.
Yeah, why would you encourage people to reach out and get mental health services?
Yeah, I think sometimes patients feel like maybe their issues are not a big deal. They think they can work through them on their own, and that might be the case sometimes, but it really is important to have community and to have someone help guide you and make sure that there aren't any red flags, to make sure that we can get them the care that they need, and honestly to make sure that it's not also a physical issue. There is definitely an integration between the two, and it's important to have someone to help to guide you through that, but you should never have to suffer alone. And this, of course, is for all ages too. We're talking about the pediatric population all the way through the geriatric population. Everyone needs support at different times in their life, and community is a big part of that.
Do you feel like there is still a stigma surrounding, conversations about mental health, or do you feel like those conversations are getting more and more frequent, especially when it comes to students and young children?
I think this generation coming up is definitely a lot more open about that, which is promising, but there definitely is still a stigma. There's even a stigma amongst physicians. We have a big problem with physician burnout, and one physician actually commits suicide every day in this country, and it's because physicians are also afraid to speak out about their own mental health. So everybody across all spectrums really shouldn't be fearful of having that label on them. It really should be more of an open conversation, because having some changes in your mood is not uncommon.
Do you feel like more and more people are seeking out mental health services, especially because of social media, or maybe because some of the stigma is disappearing too?
Yeah, I think again, this next generation I think is really helping us to just make this more of a common conversation and to recognize that sometimes you just need a little bit of help. And I think again, the fear of the cost or maybe the timing there's a lot of barriers that are out there. And I think that my patients more and more, especially because they're getting to know me and they're very comfortable with me and know that I won't judge them, I'll just be there for them. They're very comfortable to come talk to me about any sensitive issue that they think they need help with.
All right. And again, coming up, we'll be speaking with the co-founder of Taro Health to find out more about what it offers and how it's impacting Mainers. Dr. Lucas, thank you so much for your time this morning.
Thanks so much for having me.